Childhood trauma and major depressive disorder, unravelling the roots and overcoming symptoms. Hi, I'm Dr. Tony Weston. Have you ever wondered why some people develop symptoms that resemble what we now call major depressive disorder? In this series, we're going to explore 5 mental health conditions: schizophrenia, bipolar disorder, major depressive disorder, obsessive compulsive disorder, and alcohol use disorder, and their deep connection to early life trauma. Drawing from recent research using the early trauma inventory, we'll see how these conditions often stem from complex childhood experiences, reshaping our understanding of their origins. Historically, places like Victoria Park in East London, where we visited yesterday, and the asylums of the 19th century, founded at a similar time to Victoria Park, reflected society's evolving ideas about mental health, shifting from viewing these conditions as moral failings or biological diseases to recognising the role of environment, trauma, and the need for healing spaces. Just as these green spaces and institutions set up in the 19th century aim to provide respite, today we're rethinking the source and treatment of mental health problems, moving towards trauma-informed care and recovery. Join me as we uncover how our understanding of mental health has changed and is changing, and how modern approaches can offer new hope for people who seek help with mental health problems. Major depressive disorder, or MDD, often emerges from a combination of life experiences and perhaps some biological factors. However, for many, the roots of depression can be traced back to childhood trauma, emotional neglect, abuse, or a lack of secure attachment. Today we'll explore how these early experiences, especially complex trauma, shape our emotions, attachment styles, and ability to process normal human feelings, leading to the development of depression. Complex trauma refers to ongoing traumatic experiences in childhood, often within relationships that are meant to provide safety. When a child faces emotional neglect or abuse, they begin to internalise feelings of worthlessness, hopelessness, and disconnection. Over time, these feelings can form the foundation for major depressive disorder. In many cases, children who experience trauma learn to blunt their emotions as a survival mechanism. This emotional numbing or blunted trauma can manifest in adulthood as an inability to feel joy, connection, or even sadness fully. This can make depression feel even more overwhelming, as it combines emotional sadness, emotional emptiness with deep inner pain. Trauma disrupts the formation of secure attachments. Children who endure trauma may develop anxious or avoidant attachment styles, constantly fearing rejection or abandonment. Rejection sensitivity, a heightened emotional response to perceived rejection, becomes a core part of how they navigate relationships. This pattern leads to further isolation and reinforces depressive symptoms. To heal from trauma-related depression, addressing the root cause is key. Trauma-focused therapies help individuals reprocess traumatic memories and rebuild their emotional foundations. Overcoming blunted trauma involves reconnecting with your emotions in a safe and gradual way. Mindfulness and somatic practices can help individuals regain their ability to feel emotions fully without the overwhelming fear of reliving trauma. Rebuilding trust in others and forming healthy relationships is crucial for healing from depression. Through these connections, individuals can reduce rejection sensitivity and develop emotional resilience, making it easier to manage depressive symptoms. While major depressive disorder can feel insurmountable, it's important to remember that healing is possible. By addressing the roots of trauma, reconnecting with your emotions, and rebuilding secure attachments, you can regain hope and start to reclaim joy in your life. Thank you for joining me today. Remember, healing from depression is a journey, but with the right tools and support, it's a journey toward hope and emotional freedom. Take the first step toward healing, seek support, engage with therapy, and begin your journey to overcoming depression. If you've enjoyed this video, please like, share and subscribe for more on living a happier, healthier life. Thanks for watching.